Brentuximab to the front line is certainly very, very exciting to have a targeted therapy combining with, with CHOP. It's like something like we kind of wonder when are we going to have like an R-CHOP for PTCL. So certainly not for all subtypes, but at least for the CD30 positive lymphomas, and ALCL being one of them. But there are about 30% of the other T-cell lymphomas also express CD30. So I think this opens up the door for them. And there is a big randomized trial which has started, which is looking at CHOP plus placebo versus the CHP plus Brentuximab. And I think I'm quite excited by the possibility and the opportunities of that, evaluating that in the front line, and as I said, even crizotinib. We don't know if any of these drugs are curative. So obviously, if people relapse after this, there must be some resistance mechanism. I don't think it's quite figured out why or how they get resistant. But it's one thing we know is that if they respond and you take them off because they've had their 16 doses and they relapse 6 to 10, 6 months or a year later, they can respond again. But there is a subset of patients who are refractory to even all these biologically targeted therapies. And in fact, in one of our patients, we went back and checked, are they expressing CD30? And they still express CD30. And it's not that there are antibodies developing to the target either. So I don't think we totally understand the mechanism of resistance, but it's there's a lot of work to be done in that area. But it's not a common problem because the response rates are, well above the 70% range.